like how to read topics diligently is the first thing I'll address today. See, one uh, reason why this is important, especially with regards to General Studies Paper 2, why I am saying information overload. So you all know General Studies Paper 2 has polity, governance and international relations. And this is what you do a lot as part of your both prelims preparation and also current affairs, isn't it? All current affairs is polity, IR and governance predominantly, right? So there is a lot of information. So there's an element of information overload. So, but that doesn't mean that, try to understand, this is very important. All the hard work which you have already done for prelims, isn't it? While you are preparing for prelims also, you would have solved a lot of polity questions. You also would have come across many governance concepts, isn't it? You also would have solved some, what do you call, centrally sponsored schemes or other government policies related MCQs. All this work would have already been done. And you also would have practiced many international relations, IR related institutions, how they work. You may not have dealt it with necessary conceptual depth, but the point I am trying to suggest, all the hard work which you have already done for the prelims phase of the examination should not go waste. You got my point? So what a serious aspirant does is spend at least 2 to 3 days, of course, at least 4 to 5 hours. So this 10 to 15 hours, you should try to revise the content which you have already prepared for during the prelims phase. So the point I am trying to suggest, this should be your first source. This should be your first source. Let's say you are writing your mains for the second time. You are writing your mains for the second time. Then previous year mains test series model answers. Previous year mains test series model answers. And if you are diligent enough and you have your evaluated copies with you, this is another high yield resource to prepare for. Rather than wasting time on just reading toppers copies, why not you go through your own copy? This year you are going to be the topper, right? Like, have that confidence. Because as you go through the mains test series model answers of the previous year and also the evaluated copies of yours, wherein probably evaluator would have given some suggestions also, and you also would have written a lot of content. So at one go, this has the potential to boost your confidence. Okay? Like, I have already done a lot of work already in my previous year mains. And I have already done a lot of work for my prelims examination. So general studies too, there is not much you have to read specifically for mains. Unlike yesterday, general studies 1, wherein you have to read your world history, you have to read your post-independent Indian consolidation and Indian society also you have to do on resource geography, water geography, location of industries, these things, wherein you have to do it little bit main specific. You don't have that issue with general studies 2. General studies 2, largely you have already prepared, largely the content you already have at your disposal. Mains phase of preparation is more of organizing the content which you already have at your disposal, right? The reason why I am saying this is most of the students waste lot of time reading this mains documents. Okay, during mains, again, I don't want to take those names, this 365, that 365, different documents get released and students end up wasting a lot of time reading these documents, which is sheer duplication of the effort. Okay, rather than wasting your time reading all these documents, okay, start with what you have already read. Start with what you have already read. That is the best way to start, begin your preparation for mains. Okay, so that's it. Second doubt you all must be having is, sir, what should we do with current affairs? Let's be practical. Most likely, they can possibly ask current affairs only up to May or maximum June. I don't think June also is possible. May would be the cutoff limit. Sometimes they're surprised by even asking June current affairs, but that's a rarity. May would be sufficient. And anyways, for prelims, you would have already done up to March, isn't it? Up to March. Some also would do up to prelims, but at least up to March, you would have already done your current affairs. So don't waste your time, reading too many current affairs. Just take this monthly magazines, April and May. So what you have to do is already existing work on current affairs and just add this. Okay. So to consolidate, what all will be part of your mains reading material? One, the content which you have already made for your prelims examination. Two, if you have taken mentorship program the previous year, you may not have written mains, but you might have taken some mentorship program, and in the mentorship program they would have given some model answers, or you would have practiced some PYQs in case of students who are writing mains for the first time. And in case of the students who are writing main second, third, fourth time, you already would have some test copies evaluated or the mains model answers with you. That will be a wonderful source. Then for current affairs, what you are supposed to do, just read these monthly current affairs of 2 months and revise the old current affairs. So don't overload yourself with information. This much information should be more than sufficient for you to write answers in the examination hall. Okay, and yes, like I mentioned in yesterday's class, if you remember, controllables and uncontrollables are always there. If you carefully analyze the PYQ themes, I'm not going to cover PYQ themes in this session, but just an analysis, cursory analysis shows that they are largely repetitive. The same federalism, same judicial accountability, same local self-governments or urban local bodies, and certain themes on international relations are also repetitive in nature, and even governance themes are largely repetitive. The number of unconventional topics is less than 5%. Unconventional questions are 10 to 15%, but unconventional topics or unpredictable topics in GS2 is only 5%. I'm not exaggerating. You have to check last 5 years papers, not last 10 years, because General Studies 2 paper is one such, it evolves more dynamically. So 5 years analysis is sufficient. So in the 5 years analysis, what I made out is only 5% of the topics are unconventional, and only 15% of the questions are unconventional from conventional themes. So the point is simple. Do not waste your time on too much of uncontrollables. Just focus on the standards. Just focus on the basic theme. The same judicial accountability, the same comparative constitution, the same, federal relations, federal fiscal relations, urban local body, whatever. The regular themes which you cover is more than sufficient to confidently attempt the mains examination. No doubt they are asking the questions in an unconventional way, but not the unconventional topics, right? So let's not spend much time on that area. I hope I have sufficiently touched upon how to read, where to read, and I am closing this part of the discussion by saying strictly avoid all information overload, especially avoid reading this last minute revision documents which are published only for the sake of publicity. And according to me, you should learn to respect your own hard work which you have done for your prelims phase of the examination, or the mentorship programs you have subscribed the previous year, or the mains test series you have written the previous year, right? Now let's go to the next segment. How to take notes for every topic. This, like we discussed in yesterday's session, taking notes for every topic. This taking notes for every topic, what I'll try to do is, I'll try to combine it with the fourth topic which I am going to discuss in today's session, that is enhancing scores with the help of frameworks. Enhancing scores with the help of frameworks. So the point I am trying to suggest is very simple. Take your notes in such a way that, or update your existing notes in such a way that you largely address them through the frameworks. Let me not exaggerate, but to some extent it is correct. 8 to 10 good frameworks is all you need to have a mastery on General Studies Paper 2. If you put your mind, understand thoroughly this 8 to 10 frameworks, the intention behind this 8 to 10 frameworks, I'm not saying mug up. Understand the intention and flow of this 8 to 10 frameworks. This is all what you need is to stimulate your thinking and write answers effectively for your General Studies Paper 2. Now, let's get into the specifics. Let's understand one such framework. Before I situate the context of the framework, let me just write the framework on the board, and as I am writing the framework in your mind, you try to think and you try to recall what all questions can be comfortably answered if you have this framework or if you understand the intention of this framework. Okay, just observe. First, problem, you can keep writing along with me. Problem identification. Problem identification. I'll spend little more time on this single framework because I know it's important. Agenda setting. Problem identification. Agenda setting. Then policy conception. Policy conception. Then policy consultation. Policy consultation. Then policy deliberation. Policy deliberation. Then policy decision or adoption. Policy decision or adoption. Then after policy decision or adoption, policy decision or policy, then policy making comes. After policy making, you can reverse it, policy decision or policy adaptation. Then you should have legal and institutional framework. Legal and institutional framework for the implementation of the policy. You should identify financial resources. You should identify financial, keep writing along with me. You should identify financial resources or budgeting that is needed. Then comes actual policy implementation. Then comes actual policy implementation. Then as you are implementing the policy, there is a possibility that you might identify issues of coordination, and you also might issues of need for more capacity building of your human resources. And as you are implementing the policy, you might feel the need for better communicating with the people about the policy or a better public outreach. Then comes monitoring of the policy. Then comes monitoring of the policy. After monitoring of the policy, then comes evaluation of the policy. Evaluation of the policy, or also you can also assess the impact of the policy. Impact assessment. After evaluation, what else? You can take a feedback of the policy, and this feedback of the policy is the learning curve, and this in turn would lead to, or this in turn should lead to policy reform or policy redesign. Policy redesign. Based on this, we can take a decision. If it is not amenable to, if it is good with reform, then continue the policy or terminate the policy. So this is the life cycle of entire policy cycle. If you just have this framework in your mind, it will take care of most of the topics of your governance. What government does is this only, right? In the name of governance, what government does is this only. Let's observe. Any policy, it all starts with identifying the problem. This also will help you in your ethics. Please try to understand. This will help you in your ethics. This will help you in your governance. This should help you in your economy. It could be trade policy. It could be governance policy. It could be a policy on, any social issue. Policy is a policy, right? So try to understand. It all starts with problem identification. So as a civil servant, what we should do, or a government should be in a position to effectively identify the problem. Okay. So once the problem is identified, again for that, what government can do? What are the ways of identifying the problem? Say for instance, governments are having this platforms, right? Have you heard of mygov.in? What is mygov.in? Mygov.in. Government says citizen-centric administration. Mygov.in is reaching out to people for ideas, crowdsourcing of ideas. It's a classical case of citizen-centric governance. MyGov.in is a classical case of citizen-centric governance where government is trying to crowdsource, take ideas from the people. It's a classical manifestation of citizen-centric governance. Then after problem identification, then agenda setting. Then what's the next responsibility of the government? It has to set the agenda. Okay, the problem is identified. Now people have to be convinced that this problem is worth identifying. After agenda setting, what government should do? Government should start conceiving the policy. And conceiving means it should start, okay, this policy, there is a need for a policy to solve this problem. Then comes the consultation. Government should consult all the stakeholders, isn't it? As they are developing national education policy, they have done widespread consultations all over the country. They toured all over the country, interacted with many universities, interacted with many student committees, interacted with many educationists, interacted with industrial leaders. There is a widespread consultation which is very, very important for governance. And after the widespread consultation, of course, the policy was deliberated multiple times, isn't it? In the parliament, in the parliamentary standing committees, at every stage, the policy got deliberated. And only after the deliberation, a decision was taken that education policy will be there hereafter, or tribal policy, policy making was done. Once policy making is done, then it is adopted, means the decision is taken. Then here comes, don't you think every policy, for it to be actualized, there should be some law and there should be some institution to take forward that? For every policy, there should be some law, and not just law, there should be some institutional backing. Institution generally contains human resources, and there should be some law. And of course, financial resources should be there. Budgeting should be there. They should identify what are the sources of money for implementing this policy. That could be tribal policy, that could be education policy, that could be health policy, that could be policy on data. Anything needs money, anything needs budgeting. Then after that, policy will get implemented. As they are trying to implement the policy, definitely there might come issues with coordination. Interdepartmental coordination issues might come, or other coordination issues with other agencies might come. So coordination issues will always be there. And at the same time, you have come up with a policy, but the human resources you have at your disposal does not have the absorptive capacity. Absorptive capacity means, what is that? They don't have necessary capacity to implement your policy. In governance, it's very, very important. Government is putting a lot of money. Government has brought a lot of technology, but the human resources who are supposed to use this technology, if they do not have adequate capacities, then definitely it will have impact on the policy, right? So there should be capacity building of the people to enhance the absorptive capacity of the policy. Then after this, what will happen? Sometimes government has come up with a wonderful policy, but people are not aware what government is doing. So simultaneously, along with the policy implementation, there should be an attempt to communicate the people about the intent of the policy, and a wider public outreach has to be done. And also government should very carefully monitor the policy, especially the implementation of the policy has to be monitored. And as the monitoring is happening, the impact of the policy should be constantly evaluated. Is it really creating a positive impact, or it has a negative impact? Some policies have a negative impact, or it does have just a neutral impact, nothing substantial. Then comes, feedback. Okay, based on this evaluation, government should create necessary mechanisms, grievance mechanisms or normal mechanisms, to get constant feedback about the nature of the policy, and they should learn from that feedback, isn't it? All these things are already there. Don't think they don't exist. What is CP grams? CP grams is this only, right? What is Pragati platform? Proactive governance and timely implementation. It's about policy monitoring. Implementing of the policy is being monitored with Pragati platform. Government of India is already doing all these things. Let's not say that government is not doing. For every scheme, for every policy, you have all these kind of mechanisms. You got my point? For national education policy, you have UDICE plus framework, like that. You have for most of the policies. Then comes, okay, based on this learning, we tend to redesign the policy sometimes, or we tend to reform the policy. Sometimes, after reforming, the policy might continue, just like VB Gram, something they have modified Narega and they made it VBG Ramji, right? So the policy is continuing. Did they completely discontinue that policy of right to work? No, they did not discontinue it. They are continuing. After reforming, they identified issues, they reformed, they are continuing the policy. Sometimes government might felt there is no need to continue this policy. They might completely terminate this policy. So this is the entire cycle of the policy. If you just remember this, it will take hardly 15-20 minutes for you to understand the intent behind the policy cycle. If you know this policy cycle and if you know this direction, half of the questions in governance you can implement very confidently, because okay, any policy will be having only these stages, and most of the questions will revolve around, in policy revolve around this only, right? Or problems in any one specific stage. But they might be on one specific stage, or they might be in group of stages. So you need not, struggle so much in the examination hall to generate points if you are aware of these kind of frameworks. Okay. Now what you should do is take 1 minute time. Okay. And if you want to identify any question and want it to be addressed in this way, I'll do that for you. Or at least just try to read this, take 1 minute time, 2 minutes time, read this, ask me if you have any doubt in this. Yeah, please do that before I get into next framework. And what you have written now is nothing but policy cycle, framework of policy cycle. Yeah, please feel free to ask if you have any doubt here. Ah, what ma? Hmm. Yeah, of course. Deliberate is more of deliberating upon its necessity. That is what is deliberation, right? They would also deliberate upon institution, whether what type of institution should be there, what should be the nature of the institution would be deliberated. Okay, but institution is a tangible entity, right? You need to have an institution to implement something. Like most of the policies, 99% of the policies should have some institutional mechanism for it to actualize, for it to actually manifest in the real time, right? Yes. Okay. Any other doubts? Sorry. Uh-huh. You want to ask a question? Yeah, you can ask me. What is that PYQ? Come again. Developmental and welfare schemes. Development and welfare schemes for the vulnerable. For the vulnerable by its nature. By its nature or discriminatory in their approach. Okay. Discriminatory in their approach. Reasons for that last part. Your answer. Okay. Okay. 25 ID. 23. Okay. So, yeah, surprising question, right? Developmental and welfare schemes for the vulnerable. For the vulnerable. Who are vulnerable sections? You should be aware of it. Vulnerable means in general, this is UPSC's favorite area, right? You should be aware of all vulnerable sections. Like, it can be women vulnerable, and it can be, not it can be, they are transgender, Dalits, tribals, Divyangs or differently abled, then youth in conflict zones, or everybody in conflict zones, children. Okay, so yeah, these are all the vulnerable section. Senior citizens also, yeah, let's not forget senior citizens. Below poverty line, we'll not put them under the classification of vulnerable sections. That's an economic classification. Okay, and like if we really want to put it, like you can use this term called as what is that? Intersectionality. Intersectionality. What is intersectionality? You can also say it like this. Yeah, it's a compounded vulnerability scenario. Intersectionality is a kind of compounded vulnerability scenario. Compounded means one individual, he might be simultaneously a Dalit, isn't it? He can be simultaneously a Dalit and a Divyang and a senior citizen. Possible, right? So there is one vulnerability imposed on another vulnerability. We call it compounding of the vulnerability, or you can also call it intersectionality. Intersectionality. Okay, now let's get into the question. They're asking development schemes or welfare schemes, whatever, for the vulnerable by their nature or discriminatory in their approach. They're saying they are discriminatory in the approach itself. Don't you think that's an extreme statement? Okay. Saying that schemes themselves in their approach itself, they are discriminatory. So what is the current approach? What is the current approach? Current approach, we can say it is a welfare driven approach. It is a welfare driven approach. And current approach is a top driven approach. Top driven approach. So what we can say is Rather than saying that the entire approach is wrong or entire approach is discriminatory, we will try to identify the issues in the approach. Let's say issues with uh, accountability. Okay, often the approach is wrong when it comes to issues accountability, or you can say issues with transparency. You can say there are issues with the way they are getting converged or convergence. Okay, or you can say issues with innovation in the policy or innovation in the approach, or you can say issue with the way the outcomes are measured, or issues with implementing need based policies for them, or you can say issues with the sustainability, both financial sustainability and both fiscal, social and environmental sustainability of the policy. Fiscal, social and environmental sustainability of the policy. So here what I am trying to say is that I am trying to take a stand that it's an extreme thing to say that the whole approach is wrong. Rather than saying the whole approach itself is discriminatory, what we will try to do is we will try to say that there are issues in the approach. That is the stand we will try to take, and we will say these are some issues in the approach. Currently it is largely welfare driven. So what should we do? We should move from welfare driven approach to rights based approach, isn't it? So we should move from rights based welfare driven approach to rights based approach. So focus should be more on strengthening their rights than doling out. That we can say. Or currently it is top driven approach. In top driven approach there will be a lot of scope for exclusions. Exclusivity or exclusion errors will be more. So we can suggest it should be bottom up approach that will automatically enhance the inclusivity of the program, that will make the program more decentralized. The more it is decentralized, less it could be discriminatory in its mandate and approach. Or yeah, currently most of the schemes for vulnerable, we don't have strong accountability partners. Let's say only Narega has this Gram Sabha monitoring its implementation. But for many schemes like whether it is ICDS or pension schemes or different scholarship schemes, you don't have this social audit mechanism, right? Social auditing is a type of accountability tool, right? So only when there is a social audit, only when there is a social accountability, then even if there is any discrimination or even if there is any issue in the way the policy for vulnerability is being implemented, it can be fixed. But the current methodology is there are not many accountability and not many transparency provisions which are inbuilt into the way the schemes are implemented. So you can suggest we can make the scheme more transparent, we can make the scheme more accountable. And another issue with the existing schemes for vulnerable sections is lack of convergence. That is another major problem. Have you heard this term? Convergence? Convergence. What is convergence? Convergence. See, convergence is one of the important factor that is leading to suboptimal utilization of resources. In governance context, it's very, very important. It is very important reason for suboptimal utilization of resources in governance. What is this suboptimal utilization of resources? See, it's a very simple example I can give you. Previously, let's say a scheme for household sanitation. We used to have 3 different schemes. Nirmal Bharat Abhiyan for toilet construction, National Rural Drinking Water Program for piped drinking water supply, then Indira Awas Yojana for housing. See, our ultimate objective is to have a house with a toilet which is a functional toilet, which means it should have a piped water supply. That's the agenda, right? That's the objective. But 3 different schemes. Now the current government which is in power, what they did is they converged different initiatives. Swachh Bharat Abhiyan Gramin and the funds of Pradhan Mantri Awas Yojana Gramin, everything is converged in such a way that funds all flow towards a house with a toilet with a drinking water, piped water supply. That also includes drinking water supply. So that is called as convergence. Just like that, you would have heard about this, what is that? Poshan Abhiyan. Prime Minister's overarching scheme for holistically addressing malnutrition. Like that, what they are trying to do, Poshan Abhiyan is a convergence of many schemes. At the top level, convergence is done. Collaboration is an appropriate word at the top level, and at the bottom level, they are converging different funds under different verticals. For adolescent girls, one nutrition program; tribals, one nutrition program; tuberculosis patients, one nutrition program; children, one nutrition program; anemia mothers, one nutrition program. Why so many? All of them want to achieve the mandate of nutrition only, right? So convergence is at the bottom level. All of them are converged into a single funnel and are implemented in a saturated manner. Implemented till they are saturated. We call that as what you call convergence. That is nothing but suboptimal utilization of resources, and most of the schemes for vulnerable do not have this convergence. You got my point? They'll be getting money from different programs or benefits from different initiatives. There is no element of convergence. So multiple agencies are involved, multiple institutions are involved, multiple human resources are involved. All this is leading to wastage of the resources. I'll tell my practical example. Let's say when we go to, while I was working as a doctor, when we go to PHCs, there will be lab technicians. For lab technicians, there is one program, RNTCP. Now I think the program name is changed. Revised National Tuberculosis Control Program. Now I think they are calling it TB Mukt Bharat or something. TB Free India campaign. For that, there will be one technician. And there will be one technician under National Health Mission. National Health Mission is, at that point, it is NRHM, National Rural Health Mission. Now they combined Urban Rural Health Mission. They made it into National Health Mission. Nowadays, another name also they changed. Another technician used to be under this National Vector-Borne Disease Control Program. I think now also program name is more or less the same. Vector-Borne Disease Control Program is malaria control, dengue control. You generally have, and at some of the primary healthcare level centers, you have 3 technicians, but one technician will not take the work of the other technician. Now let's take a scenario. Chittoor district. In Chittoor district, you might have more tuberculosis patients than dengue or malaria. You go to Eluru, Jangareddy-Gudem, whatever, you may have, that's a little bit of tribal pockets. You may have more vector-borne diseases than tuberculosis. Or maybe one urban PHC or a rural area which is close to a city, there the disease pattern might be different. You understood the point I am trying to say? So the workload is not the same at all places. But what government does is, at all places it puts these 3 people, and at some places somebody is overworked, at some places somebody is underworked. So the convergence they are not able to do. So like this, there is a lot of wastage of resources which happens usually in the governments. That we call it as suboptimal utilization of resources. The point I am trying to say is, often in most of the initiatives which government do, they don't think through convergence, especially the schemes for vulnerable do not respect this, and they often flow in verticals. Okay, they operate in silos. And you can also write this point, not very important. You can think of innovations. Okay, when it comes to, when you are implementing schemes for vulnerable, you can think innovatively, right? Often innovations are missing. Recently, I think one of the project officer in ITDA, he tried to use artificial intelligence for, measuring the nutrition of the food provided. All these are good case studies. You also should try to gather all these kind of case studies. So innovations are often missing. Another important is outcomes are often not measured. Often it is about output. Output means how much money is spent. Even today, this is the scenario. Outcomes are often not measured. Only the output is measured. How much money is spent on this scheme? How much money is spent on that scheme? Like even while I used to work in defense, it's all about this. How much money is spent? How much money is given? How much money is spent? It's not what outcomes the money spent has produced. The problem is it's difficult to design outcomes. You understood my point? It's difficult to define outcomes. Let's say you are spending money on a particular course. That is output. What is the outcome? You getting a rank is outcome. Are you seeing a qualitative improvement in your preparation is outcome. But that is very subjective, right? What qualitative means what? It's not an all or none phenomenon. It's like this. You put money on a course, you get a rank. Is that the only outcome? maybe your knowledge levels improving also is an outcome. So it's a very subjective phenomenon. Often there is a difficulty in designing the outcomes, and that is the problem often with government schemes, especially schemes of the vulnerable. It took a lot of time for India to come up with outcomes. Only in the recent times they are talking in terms of learn. Let's say let's take education policy. Only after recent NEP 2020 they are talking specifically about foundation and numeracy, literacy, foundation, and all these specific talk in terms of outcomes is a very recent phenomenon in the Indian policy cycles. Last 5 to 10 years only. Before that, it's all about outputs, less about outcomes. Then this again is a major problem. Most of the vulnerable what do you call schemes of the vulnerable people, they are implemented for the sake of implementation. Politicians want to win the election. In some rally, they will announce 3,000 rupees, 5,000 rupees, or free bus, free laptop. So most of the things are not based on the needs. Most of the schemes which are implemented for the vulnerable sections are based on the political compulsions or electoral compulsions. Ideally, the approach should be needs-based approach. Whatever their needs, they should be compensated. But it's not just about what you call thrusting upon them schemes for electoral reasons or electoral compulsions. You can also write this sustainability aspect. What do you call, schemes, just because the schemes are being implemented for the vulnerable section, but that should not be the reason for social social sustainability issues, fiscal sustainability, or environmental. I'll just give one simple example. Social sustainability, classical example is Narega only. Intention is good, but because of Narega, in many villages, there is a conflict between intermediate caste and lower caste that actually is responsible for a social conflict. Without being mindful of the requirements of the agricultural labor of the intermediate caste and the upper caste, the scheme is being implemented. So at the right time when the agriculture labor are needed, agriculture labor used to deny the work. This used to lead to conflict between. So any scheme for vulnerable should be planned in such a way that it should not create any social conflict between various social groups. Just like that, any scheme which is conceived need not necessarily for vulnerable, but any scheme that is conceived should not have a negative impact, but it at least try to have a positive environmental impact. Let's take, they're trying to implement one Pradhan Mantri Awas Yojana Gramin. In Pradhan Mantri Awas Yojana Gramin, you have this sustainability component. If you read that Pradhan Mantri Awas Yojana Gramin carefully, they will say that for this program, one, of course, we should try to use construction laborers locally. They'll also suggest you should use local design and local construction material. Local design, local construction material. Automatically sustainability will be taken care, right? So like this, in every policy, what we should conceive the sustainability aspect. Okay, so let's not waste much time on this question alone. So again, okay, let me do something. What I have tried to teach you is what they taught me during my classes: actions approach. This actions approach you can use anywhere for any policy, issues in any policy, existing policy, and our existing scheme, to be more precise than a policy, existing scheme, how you can make existing scheme better. You can use this framework. A for accountability, make the scheme more accountable, bring more convergence, bring more transparency, bring more innovations, technological innovations, governance innovations, different types of innovations. O, focus on outcomes. N, focus on needs. S, focus on sustainability, fiscal, environmental, and social sustainability. Fiscal and sustainability, environmental sustainability, and social sustainability. What I tried to embed in that particular answer is one framework which I already had in the mind. It largely fits the demand of the question. Now going back to that that question, yes, you should not take a stand that they are discriminatory in their approach. No, they are not outright discriminatory, but there are issues with the approach. What we should try to do is, let's fix the issues in the approach. Let's also give some specific suggestions on how you can fix the issues in the approach. That's it. Okay, yeah. So all of you understood this actions framework. You can use this actions framework for even some polity topics also. Okay, but for governance schemes or many things you can use this. Yeah, any doubts here? No. Hmm? Mm. Yes. Mm. Okay. Here the what do you call discriminatory in their approach. They're not okay. Don't get into that positive discrimination, affirmative action. No, that's not the intent. Read the question carefully. I understood what you are trying to say. Are but by its nature discriminatory in their approach. Here they are trying to not talk in the terms of positive discrimination, affirmative action. It's not like that. Yes, that point can be added, but largely it is about the nature of implementation of this developmental schemes and nature of implementation of this welfare schemes is what they are trying to talk about. Huh. Within them, okay, the schemes, there is an element of discrimination in the way they are getting implemented. Okay, yeah. Uh, by nature they are discriminatory means yes, on its face it might appear like, you can definitely write that. What you said is also correct. You can write it that way, but that should not be the primary focus. Primary focus is the issues in the approach. Yes. Any other doubts? Okay, yeah. Now this is another such framework. This framework is somewhat similar to the other frameworks we discussed. Uh, this generally will work well in your way forwards. Let's say they would say how to reform National Human Rights Commission, how to reform different constitutional bodies or different legal bodies. For such questions, you can use this way forward. Let's see this. Uh, One, you can say this, yeah, policy reform. At policy level itself, sometimes you may have to bring reforms, or sometimes you may have to bring reforms at the legal level. Policy reforms, legal reforms. Sometimes the reforms should happen at the level of institution. So you can say institutional reforms. Sometimes you can bring some technological reforms. You can bring technological reforms. You can also bring human resources related reforms. Human resources related reforms, and policy, legal, institutional, technology, human resources. One point usually we tend to write separately is grievance redressal also is one thing which we often written, though it's a institutional mechanism, but we often put it separately because sometimes grievance redressal can be done by third party. This is one template you can use anywhere. Reform should come from the policy side. Sometimes it also might need reforms for fiscal sustainability or reforms for fiscal availability or fiscal sustainability, because some institutions, you know what, we should ensure that they are constantly funded without being deprived of the funds so that they can work in an autonomous way. Policy reform, legal reform, institutional reform, technological reform, human resources. So for many questions, this framework will suit well for a way forward. Way forward. Okay. So this is one framework you can use, and this framework you can combine it with the first framework I gave, or this can be used separately also. That is more illustrative framework. Okay. Now another very important framework we will try to learn. This framework, you know, will help you write even essay also. Now they're not asking questions, but any question on health security or health related topic can be easily recalled, and whatever you read from current affairs hereafter, try to situate within this framework. First observe what you are writing, write along with me, observe what you are writing, then let us try to discuss about it. Okay. There is also an acronym for this: secure care. Secure care is an acronym for this framework on healthcare. Uh, S is nothing but availability, service availability. S is nothing but service availability. Service availability, health service availability. Then you have E for equity and affordability. Equity and affordability. Okay. Then you have R for availability, round the clock, sorry, R for, sorry, C, it's not secure, right? C for choice. We discussed in yesterday's class also, right? Choice. Choice and pluralism. Choice and pluralism. Choice and pluralism. U for universal accessibility. U for universal accessibility. Universal accessibility. R for resilience, which is very important. R for resilience. Then E for evidence and innovation. E for evidence and innovation. E for evidence and innovation. C for continuity of care. C for continuity of care. C for, this is very, very important, continuity of care, which is missing in India. A for accountability. A for accountability. A for accountability. And R for resource and supply chain. R for resource and supply chain. R for resource and supply chain. And E for effective outcomes. Okay, let's spend only 5 minutes on this topic, but trust me, after that 5 minutes, your overall confidence and approach towards the topic of healthcare should ideally improve. Let's see this. Service availability. In healthcare, don't you think service availability is very important? Whether it is primary healthcare centers, secondary healthcare centers, or tertiary healthcare centers. Service should be available, right? Doctors should be available, medicines should be available, ambulatory care should be available, infrastructure, all type of cold chain infrastructure. So service availability is something very, very important, and most of the current affairs you read about healthcare topic is about lack of service availability. Okay, so that is one thing very, very important, and it is also easy to understand. First of all, service should be available, and it should be available round the clock. That is also important. Service should be available. Service should be available round the clock. If it is available only during certain type of, and one thing which we are reading a lot in newspaper these days is mental health service availability. In India, we don't have mental health service. We have primary health care, but we don't have primary mental health care. We don't have secondary mental health care. We don't have, maybe in tertiary hospitals we have healthcare, but mental health is so important, but we don't have availability of the mental health care. Geriatric care is so important. We cry foul that country has so much senior citizen population, but do we have availability of the geriatric care? No, we don't have availability of the geriatric care. So like that, in one service availability itself, we can write so many points. Now, after that, equity and affordability. This is also important. People claim India has near universal health coverage. Yes, we have near universal health coverage. We have schemes like, what is that? Ayushman Bharat. And as part of Ayushman Bharat, we have Pradhan Mantri Jan Arogya Yojana. And we also have Ayushman Bharat clinics, isn't it? What do you call them? Wellness centers. Health and wellness centers is the name they have put. And many state governments have their own versions of health insurance schemes, isn't it? Different state governments. Some state governments do not have. So yes, ours is a health insurance driven approach. Health insurance driven approach towards universal health care. But still, we are far from achieving equity and affordability. Okay, let's not take it for granted. We are lucky that we are born in Telugu states. In Telugu states, especially in Andhra Pradesh, irrespective of which government that has come to power, because health is an important political agenda, Tamil Nadu, Kerala, Andhra Pradesh have excellent health care. We can say that confidently. Because most of the services are now covered under Arogya Shri or whatever might be the name. I don't know, NTR Seva, whatever. So the point I am trying to say, and Telangana also is doing reasonably good, but that's not the case with many of the North Indian states. In North Indian states, first of all, availability itself is a major issue. Then definitely affordability and equity is a major issue. Even in many places today, you don't find primary healthcare centers, community healthcare centers likewise. So don't take our South Indian states and think that country already has equity. No, still there is glaring, inconsistencies and also insufficiency, to be precise, in most parts of the country. Another biggest issue in the country is choice and pluralism. Choice is also important, right? Pluralism also is important, right? You should have diversity in the healthcare, but we don't have the diversity in the healthcare. Often you go to a government health setup, what you get is only allopathic medicine system. But maybe some people want to take advanced Ayurvedic healthcare, or maybe yoga. Yoga is not exactly health treatment, but again preventive. Unani, Siddha, homeopathy. Simply put, alternative medicinal systems. Alternative medicinal systems are not yet available widely. Alternative medicinal systems. So we don't have a choice currently. And also the pluralism is that choice means, the treatment of choice. We don't have a basket of healthcare options. Whatever healthcare professional offers in a public healthcare system, we have to take it. You can't demand. Let's say, just to make you understand, most of the government hospitals don't perform total knee replacement. There is something called as total knee replacement. At certain age, what do you call, when knees joints get, what do you call, they put some devices or they put some implements there. The quality you can't demand. Whatever they give, you have to take it. So the element of choice is often not respected in the public healthcare setup, but we have to elevate ourselves to that state that patient should have a choice, and also the pluralism, that alternative healthcare systems or other types of healthcare systems also should be available readily to the people. Then universal accessibility is very, very important. Physical accessibility, digital accessibility, physical accessibility, digital accessibility, and of course physical and geographical accessibility, both are more or less the same. Then also social accessibility is also an issue. Social accessibility means many of the social groups still find it difficult to go to healthcare system because of the fear of discrimination. It's a reality in India even today. The accessibility should be all round: physical, geographical, digital, and also social accessibility should be taken care, which is currently, that universal accessibility is missing, isn't it? There is a popular Chinese proverb: the accessibility of the healthcare should be such that a pregnant mother carrying her 2.5 3-year-old child should be in a position to walk to the nearby healthcare system. That should be the level of proximity of the healthcare system. Healthcare should be so accessible that this mother is pregnant, but she has a 3-year-old child. Taking this 3-year-old child, she should be in a position to walk. Means healthcare should be available in that much proximity. But in most of the habitations, that is not a reality in India. Okay. Then resilience is very, very important, right? Resilience means, in spite of all shocks, it should be in a position to handle disasters. Need not be every time a disaster like a COVID-19. Even a regular health disasters also. Let's take one major accident happens, a train accident, 250-300 people die. Our public health system literally collapses. They can't handle. I have seen this firsthand many a times. Bus accidents do happen regularly, right? In India, during our times, they are much more common. Whenever a bus accident happen, ambulance bring 25-30 patients. Minimum 3-4 patients die because we don't have ICU beds, or we don't have sufficient ventilators. You got my point? If there are sufficient infrastructure, we can definitely save the patient. The only reason that patient would die is because either we do not having sufficient drugs, or we will not be having sufficient, isn't it? People dying not because they deserve to die. They are dying because healthcare system is not equipped and to handle the disasters. Just assume if an earthquake happens today in Hyderabad, is our public healthcare system equipped to handle it? 1 lakh people, 1.5 lakh people? No. You got my point? Telangana government said teams, they are building teams to handle even such disaster kind of situations. We have to see if they can really handle that load. Currently existing healthcare system can't handle that load, including healthcare system, private healthcare system. Isn't it? We have seen in our own recent memory, we have seen COVID, right? Many people died because of lack of beds, right? There are no beds is a common thing we heard. Means the existing healthcare system, both public and private healthcare system put together, is not sufficiently resilient to handle a disaster currently in India. Anyways, evidence and innovations are also very, very important in healthcare. Very, very important. Evidence based policy making, isn't it? That's why government of India has come up with this Abha number. Digital health stack. What is this digital health stack? It's not just electronic health records. It's more than that. This electronic health records are used for data crunching, for disease surveillance. Disease surveillance, you crunch this data, predict future diseases. That is disease surveillance, and probably develop what you call preventive strategies to further enhance the disease. So innovations are important, technological innovations, but one of the glaring issue with Indian health sector is medtech. We don't have a vibrant medtech in the country. Are you aware of this? UPSC also asked a question a couple of times on this. Medical technology is grossly underperforming in this country. Why? Because we don't have semiconductor fabrication. So even till recently, even pulse oximeters, all these things also we used to import, right? Only recently we are able to manufacture. But even today, CT scans, MRI scans, everything we have to import, right? So let's not get much into it. Yes, in innovations, our healthcare, even in the research innovations, clinical care innovations or technology innovations, we are lagging. And yes, evidence-based medicine is something we have to work a little more. This is very, very important. Continuity of care. Try to understand this. What is this continuity of care? Continuity of care means, generally healthcare means we think only treatment or cure. But healthcare means promotive healthcare. Try to understand, it's very, very important, this framework also. Promotive healthcare, preventive healthcare, treatment or cure, rehabilitation, palliation. All forms the continuity. I'll give a simple example. There is a senior citizen. He gets discharged from the hospital. He is apparently good. Now, the moment he moves from hospital to house, we often see in 12-15 days people dying. Why? Because there is no continuity of care. In hospital, they might have given care. The moment he went to home, maybe the family members are busy to give him care, but the country does not have a vibrant geriatric care rehabilitation system. Though they can afford, there are not many times people are not available. And some people can't afford. Ideally, you should have separate rehabilitative care centers. Have you ever seen any government rehabilitative care center in this country? That is the continuity of support. If that continuity is not there, people will die. You got my point? Just like that, palliative care also is important. What is palliative care? Like if somebody is unwell and doctors say he is not responding to treatment, we cannot just leave him like that, right? We should ensure that he dies a dignified death. So ensuring that somebody dies a dignified death, if possible, the dignified death should happen in an institutional setup, that we call it as a palliative care. Okay, the point I'm trying to say is there should be a continuity of care. Currently what we have is only treatment or cure. Other aspects are missing. Then accountability. This is very, very important aspect. Healthcare in India, there are not many, in other countries, accountability mechanisms are very strong. How many of you are aware that there are something called as Rogi Kalyan Samitis in our country? There are Rogi Kalyan Samitis. UPSC asked a question once on this. Rogi Kalyan Samitis, village nutrition and sanitation committees. Rogi Kalyan Samitis are the group of people, they can ask questions. They can ask, they are available they are considered at the village level, Gram Sabha level, and they can question, if anything is lacking in the primary healthcare setup or in a community healthcare centers or even a tertiary healthcare centers. But the level of awareness on this is very less. Healthcare accountability, healthcare regulation, healthcare audits and patient rights is another important segment of the healthcare, and UPSC is consistently asking questions on this. Okay, so prepare thoroughly on this. Healthcare regulation. I think they asked question on clinical regulation act also. Regulation, healthcare audits, especially what you call medical audits and other types of audits. Healthcare regulation, healthcare audits, patient rights. Okay, so all these aspects are very, very important in the context of course, resources are very, very important. Resources means, everything, medicine, infrastructure, ambulatory care, and we should have effective outcomes also. Like what type of outcomes? Let's say how much is the improvement in the nutrition, how much is the improvement in the mortality rate, under 5 mortality rate, neonatal mortality rate, infant mortality rate, all this measurable outcomes, how much specific outcomes were achieved in each of this healthcare. So if you just have this framework in your mind, most of the questions on healthcare you can Easily write, and every topic hereafter you read on a healthcare, try to situate within this framework. Okay, so just take 2-3 minutes time, try to understand what we have discussed. Ask me if you have any doubt, and also tell me if there is anything else we can add to this framework. Every year at least 2 or 3 questions they are asking on healthcare, right? It could be in 1, it could be in 2, or it could be in 3, sometimes also in ethics. Question on healthcare is something you can't escape. Who knows, sometimes an essay also might, reflective essay wherein you have to write a lot about healthcare also is a possibility. So prepare thoroughly on healthcare. Okay. Or this framework, though we prepared it for healthcare, you can apply this framework for other topics also. Yes. See it once, ask me if you have any doubt. You don't need to even mug up, right? Simple. Secure care. That is the acronym. Secure care. Remember that secure care? Think about it 10-15 times, then your healthcare topic is done. Hope you are taking down what I am suggesting, saying. Yeah. Any doubt in this, or is there any PYQ on health topic if you want to quickly check? Let's see if we can answer with the help of this framework. Yeah, anyone? Please do that. You want to see PYQ? Yeah, quickly do that. Okay. అలా ఎలా ఉన్నాయి, లైక్ సపరేట్గా టాపిక్స్ మీద హెల్త్ PYQs ఉన్నాయా? ఓకే, ఇంట్రెస్టింగ్. ఓకే, ఆస్క్. Which year? In a crucial domain, like in a crucial domain like public healthcare system, yeah, then Indian state should play a vital role. Okay, should play a vital role to contain the adverse impact of marketization of healthcare. Oh, then suggest some. Through which state can enhance the reach of public health care. Directive came later. That's the only directive they gave. Okay, so in a crucial domain like public healthcare system, what they're suggesting, the statement itself is saying Indian state should play a vital role. Why Indian state should play a vital role? Because it has to contain the adverse impact of marketization of the system. Marketization means private healthcare only, right? Suggest some measures through which state can enhance the reach of the public health care at the grassroots level healthcare. Okay, so as they haven't given any directive, maybe the UPSC wanted you to take a stand a little bit against the private healthcare, but need not overdo that. What they are trying to say is that adverse impact of marketization. It's not they're trying to say that every time private healthcare is bad, but sometimes, too much of marketization, because it's a crucial domain. Public healthcare is a crucial domain. So Indian state should play a good role, so that, what it should do, it should enhance the reach of the public healthcare system at the grassroots level. So what should government of India do? What should government of India do is what they are trying to suggest. So approach is very simple. Okay, it's not a difficult question to, what you call, deconstruct. They are trying to say that public healthcare system is important. So very briefly write why public healthcare system is important. Don't overdo that part. Just one fourth page or half page, assuming 3 pages. Public healthcare system is vital because 1, 2, 3, 4. Then adverse impacts of marketization in the contemporary times. Just mention again, not overdo. 3-4 points on adverse impacts of marketization because of the private healthcare system. Definitely there are some adverse impact. Let's acknowledge it, but let's not overdo it. 3-4 points under that. Now, necessity. Okay, necessity you have already mentioned, right? The first part is that. Then measures. Directly get into the measures. How can public healthcare system can be strengthened at the grassroots healthcare level? So I think we can still use the secure care framework. Okay, public healthcare should be available round the clock. You should take care of this. Public healthcare should, grassroots level, should take care of this. At grassroots also you can do this. Grassroots you can do this. Grassroots you can do this. At grassroots you can do this. Grassroots level you can do everything, right? So secure care is sufficient to write that answer. Okay, but use some jargon also. And in conclusion, what you should do is, you can write that. Don't take a stand in the conclusion that we have to get rid of private healthcare, something like that. That's an extreme statement, because information asymmetry, you must have heard this term. What state should do is, state should not shy away from encouraging. See, the reason why India is now ranking top 3 to 5 in the world healthcare is because of privatization. Let's accept it. Let's not glorify old style socialization, socialist mindset that public healthcare system alone is sufficient. We should have a right combination or optimal combination of both public healthcare and private healthcare system. You can write that in a concluding remark, but with necessary regulation. Reason being, this you need not write. Information asymmetry is something no one can address. Like in a healthcare system, information asymmetry is always there. Means doctor can always confuse you if he want. You read ChatGPT, you use the best AI tool and go to doctor with all the knowledge. Still, if doctor want to confuse you, he can confuse you. Very simple. Let's assume I am a doctor. You come to me with a health that I have a headache, and you use ChatGPT and you show off your knowledge and you tell whatever I say, you cross question and you think, yes, I am arguing well with the doctor. In the end, I would say, yeah, I don't think it's a problem, but somehow I have seen one case like this, adverse income, that this guy got diagnosed with brain tumor. He did not do, I just asked for the CT scan report. This guy has argued with me, but now this guy is diagnosed with brain tumor. He might die in the next 1 month. Then done. Because my experience or my good communication can always trump your best of your knowledge. Information asymmetry is always there. That is one simple scenario. Second scenario, I do some ultrasound or whatever, and I am the one I am reading. I would say you have only one kidney, or I would say something, or your half kidney. Only thing, I and radiologist should be friends. I'll tell my radiology friend, "Arey, write this thing." And even if and it's all about change. Of course, you may not have a radiology friend to send your what do you call, imaging. It's all too much time and effort. Who will do that much? So information asymmetry is always there. So what government already is doing. Don't think that government is not doing anything. They are already Clinical Establishment Act is there. Now the demand is for a medical ombudsman. We'll talk in another context. Let's not waste much time on that. Let's get into the next framework. Again, a very important framework. This framework is for education. Okay. This is very similar framework. Secure, in this case it is learn. Secure learn is the framework. Secure is still the same. S for school availability, college availability. E again for equity and affordability. C for choice and pluralism. Government, private, digital, occasional, open learning, everything should be there. U for universal accessibility. R for resilience again. E for evidence and innovation. Some of you may be thinking, what is resilience? Yes, for education also resilience is very, very important. During COVID-19, did we not see? UPSC also asked a question on this, right? COVID-19 and educational outcomes and school dropouts. UPSC has asked a question on it. So, education outcomes are also very, very important. And especially in the conflict areas, it's very common. One small conflict, schools will remain closed for 1 month, 2 months. Especially in Naxal infested regions or Northeast India, where insurgency is common in Jammu and Kashmir, or places with natural disasters, isn't it? Go to agency area. Even today, one rainfall, road gets washed away. Children have no school for 1 week, 2 week. More in summers, sorry, in rainy seasons, most often they don't have schools. They'll have schools only after the rainy seasons. I'm not talking about 10, 15 years scenario. Even today, you don't have proper roads in most parts of the agency area, and some pockets of Telangana also more or less this scenario is same. So the point I'm trying to say is, let's not assume that now all schools are available throughout the year or irrespective of any disaster. No, for many students even today resilience is an issue. Okay, now evidence and innovation. Yes, here also we have edtech, AI, learning tools. All this is important. Regarding learn is nothing but write down. L is for learning outcomes. L is for learning outcomes. L is for learning outcomes. E is for, this is very important, educators capacity. Educators capacity. Educators capacity means teacher training, workload, teacher training, workload, motivation, teachers motivation, and recruitment. E for that. A for accountability. A for accountability. This is again important. A for accountability. School audits, parent committees, grievance redressal. Do we have any such accountability in India currently? Anyone? Ah, పేరెంట్ టీచర్ మీటింగ్ ఏదో ప్రైవేట్ స్కూల్స్ పెడుతుంటారు. School management committees, there are SMCs, school management committees. If anyone work for government in the grassroots level, they would be aware. There are school management committees. They are very powerful in India. Even if a principal want to buy a chair, school management committee has to give approval. Okay, we already have. Only thing, many times they are not functional, or people are not aware of this SMC, school management committees. Then R, R for resources and infrastructure. This you already know. Resource and infrastructure. N for need-based curriculum. This is very important, especially in the context of tribals. Need-based. What tribals? For everyone, right? Need-based curriculum. Need-based curriculum means local relevance. Local relevance, yes. Local relevance. Skill. Local relevance. Skill-based. Employability. Employability. Employability means, what is employability? Ability to get an employment. Your education should help you to get an employment. Only then such an education has employability. Otherwise, the education does not have employability. And values. Values. Local relevance, skills, employability, values. Local relevance, skills, employability, and values. Isn't it? Curriculum should have at least some local relevance. But now it's other way around. People are reading Cambridge, what all, IB, Montessori, what not, I don't even recall. Harvard good unda, Harvard, Oxford, all international education. This guy do not know our anything about our native culture, does not even know our local food we eat, isn't it? This guy is always getting international education with local common sense, with very minimal local common sense, which actually is important for him for his day-to-day survival, right? So local need-based curriculum is very important, wherein local relevance is very important. So this is for education. And is there any PYQ for education also? Let's see if we can. Yeah, topic wise PYQ. Is that a booklet or you made it? Okay, Good. At least people are using AI in a positive way. Uh, uh, okay. Rights of rights of children to free and compulsory education. Rights of children to free and compulsory education. Okay. Act 2009 remains inadequate. Yeah. Remains inadequate in promoting an incentive based system. In promoting an incentive based system. Incentive based system for children's education. Okay. For children's education without generating awareness. Okay. Without generating awareness about importance of schooling. Then analyze antena without importance of schooling, and they want us to analyze this statement. So rights of children to free and compulsory education act. Okay. Right to education 2009. What they are trying to say, that they are saying that this law is inadequate. And inadequate in what? Promoting an incentive based system for children education without generating awareness about importance of schooling. So it seems there are two components in this question, right? There is a law, and what is this law about? Free and compulsory education. And they are saying specifically the law failed on two fronts. What two fronts they are saying? Law is not able to promote an incentive based education system. That is where the law is insufficient in its workings. What is the other aspect in which the law did not work adequately? And awareness generation about importance of schooling. Analyze. Okay. So yeah, for attempting these kind of questions, you should have little bit of knowledge about what's happening in the current affairs, current awareness. And yes, like we discussed in yesterday's session, these kind of questions also you need to have good amount of knowledge about some facts and statistics. Okay, isn't it? You have to say, you have to prove it properly, right? How can we just say that the law is I mean the law is not fully functional? How can you say that? By yes, very good. We can say it by specific facts. Say we should tell gross enrollment ratios, and especially not just gross enrollment ratios, differentials. Differentials. What is differentials? Rural urban differentials, gender differentials. Okay, rural urban differentials, gender differentials. We should tell this. Means both geographical and gender based differentials you should tell, and you should first establish that. That again, that part you should not overdo, but first you should establish yes, RTE did not. And you can also take some stats from UDICE Plus, isn't it? For RTE monitoring, there is a UDICE platform, right? UDICE Plus platform. From there also you have to take out some stats, isn't it? You should tell this foundation, numeracy, literacy. Again, whatever I'm saying, this should not be overdone. This should be only half page. Then you will, again, as I said, this question requires little more, what do you call, specific case studies and examples. Okay, you should tell incentive based system for children education. What is this incentive based system for children education? Incentives for whom? Incentives for all stakeholders. When I'm saying incentives, don't incentives only for incentives for all stakeholders. Otherwise, why, though it is a matter of right, compulsory education is a right, then even then why people are not using it effectively? Because we have not created proper incentives. Incentives for whom? All stakeholders. Who are the stakeholders? First, parents. Children themselves are the stakeholders. Then teachers are the stakeholders. Other non-teaching are the stakeholders. Who else? School administration. I mean, district administration, school administration is the stakeholder. Civil society is the stakeholder. Gram Sabha is the stakeholder. Urban local bodies are stakeholders. You have to give incentives for everyone. Only when you give incentives for everyone, everyone will understand the significance of the law, letter and spirit of the law, then they will use the law effect. It's a slightly difficult question because you need to have good newspaper reading knowledge, good current affairs knowledge. So incentives should be a holistic system. Just giving incentives, amma vadi, give only to mother may not work. Incentive should be for a teacher if he is bringing good results. Incentive should be for school administration at the district level. Incentive should be for the civil society if they are actively participating in learning outcomes. Yes, there should be 360-degree incentive system. Only then everyone will take it seriously, isn't it? I'm sure some of you must be already aware there is a mandatory certain percentage of the seats should be allotted in private schools as part of social education policy, but this is seldom implemented. Simple. Why? Because schools bribe NGOs. Educational NGOs are bribed by schools. Don't create nuisance out of it. Don't bring this matter out. So nobody questions this, but in fact it's a matter of right in private schools. Don't think that not just aided schools, even in regular private schools also certain percentage of the seats have to be allotted to the socially backward as part of the right to education act, but that seldom comes out in the discussion. Only in Yojana articles you will see that, or once in a while Hindu writes it. No other media usually reports the importance of it, but it's a reality, isn't it? Like that. Another aspect is about awareness. Awareness about what? That education is a matter of right. Even today people feel education is a dole or education is a welfare. No, we should move from this welfare approach to rights based or welfare based approach. Sorry, welfare approach to rights based approach. People should demand it as a matter of right. But this will happen. Awareness means what we write in answers is generally public outreach campaigns or what you call media awareness or using local arts. No, that's a very superficial way of generating awareness. Real awareness is ownership. Create ownership to the people, which means again same, go back to the same framework. You can use that actions again. The policy should be such that, okay, where did I write that actions approach? The policy should be top down, should not be top down, it should be bottom up, isn't it? So there should be convergence of all education related funds, everything, and there should be transparent, there should be accountability, and there should be scope for local innovations in education. There should be scope for measurable outcomes, and there should be education should be need based, local relevance, employability, skills, like what we have. And that is the way we have to create ownership, then automatically awareness will come. Without ownership, awareness will never come. People have to be given ownership, then awareness is a natural outcome or a natural byproduct. Otherwise, just by publicity or just by outreach campaigns or by media campaigns, never, that will never happen. People should be made part of the developmental discourse. People should be made part of the implementation, then automatically we call, isn't it? That's called a stakeholder approach, right? Everyone should be involved. Then awareness will come automatically, right? Yes. So that's it on this education. I think, yeah. So let's, before we get into IR framework, as part of the notes, let's write one more thing, like as you're taking notes, apart from frameworks, make all these things. This I already told for previous topics, but here also. Introduction. For all the topics, let's say a topic called as self-help group. Have all these things. Introduction. Or it could be a topic on charity. Anything. a proper conclusion, a proper introduction, and wherever scope exists, again, be ready with framework. Again, wherever scope exists, be ready with keywords. Let's say something on self-help group. The terms like social capital, social dividend, like I discussed, SHG is in paper 2. So all that keywords related to it, you should have in your mind. And poverty, self-fulfilling equilibrium, and of course some facts related to it, and some stats on SHG, and of course some good case studies of SHG success, and also some case studies of SHG failures. Both SHG success Yojana will have plenty of them, SHG success, SHG failures, and best models, and policy support government is giving for SHGs, and innovative way of connecting SHGs to other stakeholders. It could be banks, it could be skill development agencies, it could be industries, it could be, I mean, SHG other stakeholder linkage, like this. Okay, let's. I think we have unnecessarily went to SHG specific. I mean, let's make it policy support for that particular topic. Then that particular topic may also have case laws related to it. Okay, case laws related to it. Again, opinions. This is polity, right? Opinions of jurists, opinions of some noted administrators, or again opinions of celebrated NGOs, or awardee winners like Raman Magsaysay awardee winners, anyone who is working in this domain of civil society organizations who got international awards. It could be Kailash Satyarthi, it could be Yusuf Malala, all this kind of people, their observations. Okay, so as you are making notes, make notes like this. Did I write case laws? Yeah, case laws on that particular topic, and observations, if any, made by, sometimes some constitutional bodies also make some observations. It could be judiciary, it could be CAG, or it could be, other constitutional bodies. If they make some observations on that particular topic, note down all those observations. And let's say for some topics, I have already written best models, but sometimes you can also inspire for the best models from the constitutions of the other country. This is also related to comparative constitution topic. Best models you can also learn from other countries. Okay, and always try to prepare in terms of, for every topic, especially governance, there is always a scope for collaboration. So with who else can collaboration happen for the effective outcomes of this? I'm giving a generic framework, which is, your notes should be on these lines. Check for particular topic if any of this will, if any of this is a possibility, then you have to write your notes in that way. Okay, it's a very generic framework. You should be prepared with introductions, prepared with conclusions, have frameworks. We have discussed good many frameworks, but for every topic, try to identify framework. You should be ready with the keywords specific to the topic, facts specific to the topic, statistics specific to the topic, case studies specific to the topic, both failure case studies and successful case studies, best models available, and yeah, any dedicated government policy support related to that. Let's say it could be on NGO, it could be on charity, it could be on SHG, it could be on, sometimes government also must be doing something already for that. Any case laws related to it, especially in polity, you always have scope for case laws. And any comments made by constitutional bodies, or any comments or observations made by administrators, jurists, prominent social activists. Then of course some content from comparative constitutions, and always search for collaboration, because this is a very, very important idea. and SDG 17 also talks about collaborations, right? So that this will be appreciated. For every topics, see the scope for collaboration. Like it need not be implemented by government alone, or it did not be done by government alone. It could be even a topic related to alternative, what do you call, alternative justice system, or something related to tribunals. Even for such topics also, there is a scope for collaboration. This is a very broad term. The term collaboration is having a wider applicability. You can use it at many places. This is one generic framework which you can be using in notes taking. Okay, now let's discuss one framework for IR. Again, if you have this framework in your mind, it will make your IR preparation easy and recalling of IR topics easy in the exam. Remember this acronym, geospectrum. Geospectrum. Okay, geospectrum. So quickly write down. G stands for geography and geostrategy. G stands for geography and geostrategy. G stands for geography and geostrategy. E stands for economy, energy and supply chains. E stands for economy, energy and supply chains. O stands for international order and organizations, international organizations. O stands for international order and international organizations. S stands for security and sovereignty. O stands for international order and international organizations. S stands for security and sovereignty. S stands for security and sovereignty. P stands for power balance and partnerships. P stands for power balance and partnerships. P stands for power balance and partnerships. E stands for environment and global commons. E stands for environment and global commons. E stands for environment and global commons. C stands for culture, civilization, diaspora. C stands for culture, civilization, diaspora. C stands for culture, civilization, diaspora. E stands for environment and global commons. P for power balance and partnerships. S for security and sovereignty. O for order and organization. Then C for culture, civilization and diaspora. T for technology and connectivity. T for technology and connectivity. T for technology and connectivity. Okay. R for regional dynamics. R for regional dynamics. R for regional dynamics. U for universal values and norms. U for universal values and norms. M for methods or instruments of diplomacy. U for universal values and norms. M for methods or universal values and norms. M for methods and instruments of diplomacy. Okay. I'll quickly read. Observe once again. Methods or instruments of diplomacy. G for geography and geostrategy. E for economy, energy and supply chains. O for order and organizations. International order and international organizations. S for security and sovereignty. P for power balance and partnerships. E for environment and global commons. C for culture, civilization and diaspora. T for technology and connectivity. R for regional dynamics. U for universal values and universal norms. M for methods and instruments of diplomacy. See, this framework alone is sufficient. Even if you sit here and if you want to recall any of the IR topic, if this framework is in your mind, you can easily recall any of the IR topic. Let's say they give you a question on which you don't know anything. Randomly they give India Middle East, or they give India Mercosur, or to make it difficult they frame a question India and some random Balkan. They are not giving, but let's assume they give India and some Balkan country. If you have this framework, at least you can write something and come out. You can fill the paper, isn't it? Let's see this. Geographical and geostrategical. Between any two countries or any country and another group, there will always be a geography element and a geostrategic element, right? Let's take India, China. There are many geographical conflicts itself. Or geostrategically, you see, you have many straits, you have many isthmus, all this. So geostrategically, geographical aspect is very, very important in international relations. So for the given topic, always find that geographical connection. Let's say Project Mausam. Project Mausam has a geographical connection because we are doing Project Mausam with those countries with which India traditionally has trade, maritime trade culturally. So like this, everything has a geographical or geostrategical dimension. Geostrategy is whenever there are isthmus. The reason why we are close with Southeast Asian nations because of their proximity to Strait of Malacca. The reason we used to have good relation with Iran is because of Strait of course, now things are not working the way we are supposed to work, but that is the reason we used to traditionally maintain. So like that, with every country, we maintain good relations both for geographical and geostrategical reasons. But the same geographical and geostrategical reasons can be the sore point between any two countries. Simple, commonsensical. So nothing to mug up. Then for most of the countries, it is about the reason why we come with it's E for economy or trade, that is need not tell, so basic. Energy and supply chain. With half of the country, the reason why we maintain international relations is energy security, isn't it? Our energy security is very, very important for us, and to secure our supply chains is very, very important for us. If you see half of the negotiations which we see in they are about energy security only, right? Either renewables or civil nuclear energy supplies. In some cases, it is hydro energy diplomacy with neighboring countries like Nepal, or to some extent, Nepal. It is hydro diplomacy with Bangladesh also to some extent river water sharing hydro diplomacy. So it's largely about economy, energy, and again to ensure our supply chains are intact. We become part of different groups, right? What is that? Supply chain resilience initiative, something. India is part of that supply chain. After COVID, India joined part of the supply chain resilience initiative, right? To ensure that our supply chains are intact. So that is one common theme in all IR. Then international order and international organizations. So in all international relations, this is a common thing. To maintain global economic order, to maintain our with every country, there is a reason why we maintain relationship, because we want to be part of some international organization. It could be UNSC or it could be anything. We want to be part of G7, we want to be part of UNSC, we want to be part of some organization. That is the reason why we maintain relationship with some countries. Or we directly be part of a, what do you call, if not a main member or a additional member to that organization. So that is one thing you should be clear about. Then with every country, we have some security issues or sovereignty issues, isn't it? Pakistan, we have security issues. Bangladesh, we have security issues. Myanmar, we have security issues. Afghanistan, we have security issues. China, we have security issues, isn't it? And that golden triangle, we have security issues. With some countries, we have sovereignty issues. Sovereignty issues mean direct disputes. Pakistan, Bangladesh, we have disputes. Nepal, we have disputes. China, we have disputes. We have maritime disputes also with some of the countries, isn't it? So this is security and sovereignty. Then power balance and partnership, you have to remember why we get into Quad, why we get into what do you call, there is another thing recently with India, Saudi Arabia and Turkey. India, Saudi, sorry, not Saudi Arabia, India, UAE and some other country have come together. It's purely to power balance. Like this, everything, what is that? Not Quad. I2U2, right? I2U2. So most of the international relations are about power balance, partnership. So again, another important aspect, environment and global commons, you should definitely write in everywhere. What is global commons? No, not global south. Global commons are these things, right? Outer space, high seas, outer space, high seas, and Antarctica is another global common. Then what else? Atmosphere is also a global common. Some are saying even cyberspace should be made as a global common, but there is a debate whether cyberspace. So most of the international arrangements will be revolving around global commons only, right? With a fellow country, we will always talk about how to secure space, how to secure cyberspace, how to secure high seas, maritime security, all these things we talk. Then with every country, we'll have some culture, civilization and diaspora. South Korea, we have a civilizational connect. Southeast Asian, we have a civilizational connect. Middle East, we have a civilizational connect. So that also gives a scope. Diaspora with many of the Caribbean nations, many of the, what do you call, this association of small island states, we have diaspora connect, like that. Technology and connectivity, defense technology, space technology, nuclear technology, biotechnology, with many countries we have this. Connectivity, we have different corridors also, right? International North-South Transport Corridor, IMEI corridor, all these corridors. With some countries, we have this regional dynamics. We are part of different regional groupings also, right? We are trying to be part of ASEAN Free Trade Agreement. We are trying to be more closer to Mercosur. All this regional dynamics are, our association with European Union like that. And at the same time, in every international nation, there is scope for universal values and certain universal norms we stand by. Let's say India stand by democracy. India stand for respecting the sovereignty of the other countries. There are certain universal values and norms. Okay, and methods could be what you call fast track diplomacy, second what do you call fast track diplomacy it could be, and what are the different types of diplomacy we follow, right? Confidence building measures, different types of diplomacy or different methods of diplomacy. So if you remember this geospectrum well, even if you do not know anything about that international relations topic, at least 5 to 6 points you can pick from it, or 5 to 6 ideas will come to your mind, you will write and come out. If you know specifics, perfect. And even specifics you can recall through this geospectrum framework, right? So it is that simple. So yeah, I think these are the frameworks. What I'll try to do, like, for main students, I'll give as many frameworks as possible. I already told content developer they are preparing ones on society. Governance is almost done. I have to just do second layer check before the completion of this session itself. I'll share that. I'll try to create a Telegram group or something like that with main students, and I'll share with you guys this governance. There is this proper 50-60 page document. I'll try to share it with you all guys. So we have 5 more minutes time. Any PYQ you want to discuss? Any PYQ topic you want to discuss, or just revise what we have taught till now and ask doubts in this, or PYQ? Anything is fine. There can be questions on bilateral, multilateral. That's what you have to pick points from this geospectrum. Geospectrum, what it is, just a what do you call panic button framework. Not that, and it also will help you recall things. It will help you recall things. Let's say you just want to recall some international relations topic, and you are not able to think where to start it from. Start with geospectrum. Okay, is there any geographical element? Is there any economy trade element? Likewise. So it's a good framework to recall. Yes. Yeah. We take one question. Yeah. Which topic? A topic? Ah. Mm. Geopolitical and geostrategic importance of Maldives. It's a bit specific, right? Geopolitical and geostrategic importance of Maldives. Then for India. And focus is on what? Which year? Maritime security, regional stability amidst proper chat GPT question. Human mind cannot frame question like this, right? Did you understand? They have not applied mind in framing this question. If you, I don't know about that. This is 2025 mains, 24 probably. I think. See what they are saying. Geopolitical and geostrategic importance of Maldives. Very good. So we will talk about geopolitical importance of Maldives. It's a neighbor, so geopolitically it is very, very important for us because we know the intrusion of China and how China is trying to use Maldives as a way of what do you call as a bargaining chip with us. Geostrategically, I mean strategically it is located in such a place that it will have impact on our economic zones. It will have impact on our maritime security. Likewise, suddenly why global trade and energy flows have come. You understood my point? It's a bit I don't think the question should be, I'm not trying to blame them. It could be a little more diligent. As I am talking about Maldives and its geopolitical and geostrategic impact, suddenly if I want to talk on global trade and energy flows, I want to suddenly focus on, how can I focus on, you understood my point? It's a bit difficult to understand. PSR students might be there. They should tell us. And again, this is okay. In the context of international intrusions, maritime security, regional stability, we know China is trying to, what do you call, develop ports and develop, what do you call, calling points in as part of that, and it has the potential to create regional stability. It is okay, but this I'm really not sure. I don't know how can you connect it to global trade and global energy flows. Again, it's purely because of sea lanes of communication. There are some sea lanes of communication that passes close through Maldives, and because of that, it could possibly impact global trade and global energy flow. I personally believe the question should be a little more diligent, not to blame. No doubt, we all know that Maldives has geopolitical and geostrategic importance. And we all know that it will have impact on our maritime security. It will have impact on the regional stability because of the involvement of some international players. But connecting it to global trade and global energy flows is a bit difficult because I don't think there is so much content we can actually talk on that lanes other than its impact on possibly sea lanes of is there anything other than it? I don't think there is anything more than that also. Yeah, right. I think this approach it's a simple question only, straightforward question only, right? There is nothing, it's not difficult to deconstruct it. There is nothing much to analyze. They only have explained everything and they want you to write in some specifics and detail about it. Yeah, it's not a difficult question, definitely. Yeah. Chalo, I'll stop the session for today. And yeah, one last thing, write tests. GS2 is one easy thing. So people write good number of tests anyway, even without me telling. One mistake students do with GS2 is they don't practice governance enough. Polity, constitutional polity, up to comparative constitution, students are reading. Governance often is getting ignored. But year on year, governance weightage, they are increasing the governance weightage. So please don't do that mistake. Good focus, good number of, if possible, write one dedicated test on governance also. And IR anyways is an interesting subject, so you will read it. IR, nobody will leave IR and go because it's easy to understand, it's easy to read, it's exciting to read about IR, isn't it? So IR should not be a problem because, and also they're not asking tough questions from IR. Largely they are confining to the neighboring countries. Sometimes when something is very important, they are going a little bit away and they are trying to ask questions. So I don't have much concern with IR topic because plenty of material is available for IR and plenty of tests are also available for IR, and students as such like to read IR. Isn't it? Internet content is full of IR only, right? A lot of IR. People watch a lot of IR content everywhere. You see, even in one of my friend is a doctor. We went on a trip and he's trying to argue with me about what do you call some at that time this India Middle Eastern corridor or something. I asked, why are you're a doctor, then you can discuss about other India problems, right? Why are you interested means the problem is in internet algorithm recognizes IR content well, so IR is available everywhere. So don't go by this IR bias. Read governance also, read polity also, read constitutional polity also, write tests on that. Of course, don't undermine IR, give it the respect it deserves. Got it? Yes, I'll stop the session for today. Thank you. Tomorrow economy is one area many people find it difficult. We'll talk about keywords, little bit more focus on keywords in economy. Frameworks less, we discuss frameworks also. Science and technology, another area people don't give adequate emphasis, that also we will do. Internal security and disaster management, that we will do in tomorrow's session. Yeah, thank you.